Stroke is one of the leading dangerous diseases, which can occur suddenly and leave severe consequences for health. However, before a stroke happens, the body often shows early warning signs, allowing you to recognize and intervene in time. These symptoms may appear from a few days to a month before the serious event occurs, but if not noticed, they can be overlooked. In this article, we will explore 8 early warning signs of stroke and 9 effective tips for preventing this risk, helping protect your health and enhance the quality of life. Follow along to equip yourself with important knowledge that will help you live a healthier and safer life every day. 8 early warning signs of stroke 1 month before. 1. High blood pressure and its relationship with stroke. High blood pressure hypertension is one of the biggest risk factors for stroke and is often considered a warning sign before a stroke occurs. In many cases, blood pressure can gradually increase over several weeks or even months before a stroke actually happens, but the patient may not feel this change. This is why high blood pressure is called the silent killer, as it does not have noticeable symptoms until serious complications such as stroke occur. High blood pressure can damage blood vessels in the body, especially in the brain, where small blood vessels may rupture or become blocked, leading to a stroke. When blood pressure consistently remains high, the blood vessel walls become thicker and weaker, allowing the accumulation of fatty plaque and cholesterol, which causes blood clots. This reduces the flow of blood and oxygen to brain cells, potentially causing cell damage or death, leading to a stroke. Furthermore, high blood pressure also contributes to an increased risk of hemorrhagic stroke, a type of stroke that occurs when a blood vessel in the brain ruptures, causing bleeding. Therefore, controlling blood pressure is one of the most important measures in preventing a stroke. Patients should regularly check their blood pressure and take early intervention measures if high blood pressure is detected, including changing their diet, increasing physical activity, and, when necessary, taking medication to manage blood pressure. 2. Unusual headaches, a sign of an impending stroke. Headaches are a common symptom many people experience, but unusual headaches, especially sudden or progressively worsening ones, can be a sign of a stroke or a transient ischemic attack, TIA. This headache is often not like the usual headaches that we might go through. It can come on quickly and strongly, sometimes accompanied by other symptoms such as blurred vision, dizziness, or nausea. A headache caused by a stroke is usually the result of blood not being able to flow to a part of the brain, leading to a lack of oxygen and nutrients for the brain cells. When a blood vessel in the brain becomes blocked or ruptures, the brain cannot function normally, causing severe headaches. If you experience an unusual headache, especially if it is accompanied by other symptoms such as blurred vision or difficulty breathing, you should see a doctor immediately for a proper examination and diagnosis. Another type of headache may be a transient ischemic attack, TIA, in which blood temporarily does not flow to a part of the brain. While TIA may not cause long-term damage, it is a serious warning sign that a full-blown stroke could occur in the near future. Therefore, when experiencing an unusual headache, be proactive in getting a health checkup to prevent the risk of stroke. 3. Numbness or weakness on one side of the body, a sign of stroke. Numbness or weakness on one side of the body is one of the most common stroke symptoms. This condition occurs when blood flow to part of the brain is disrupted, leading to the loss of movement or sensation in the opposite side of the body. For example, if blood flow is interrupted in the left hemisphere of the brain, you might experience numbness or weakness in the right side of the body, such as the arm, leg, or face. This numbness or weakness can appear suddenly and is a warning sign of an impending stroke. It can also occur during a transient ischemic attack, TIA, in which symptoms may disappear after a few minutes or hours. However, if these symptoms persist or do not resolve, it is a serious sign that requires immediate medical attention. If you experience numbness or weakness on one side of your body without a clear cause, it is essential to go to the hospital for a checkup. Diagnostic tests can help determine the cause and severity, allowing the doctor to recommend appropriate treatment. Early detection and intervention are critical to reducing the risk of severe strokes and potential complications. 4. Difficulty speaking or understanding speech, language impairment, and stroke. Difficulty speaking or understanding speech is a concerning sign of a stroke, especially when a change occurs suddenly and without an obvious cause. A stroke can damage the area of the brain that controls language, making it difficult for a person to pronounce words or understand what others are saying. This may be a sign of a stroke affecting the areas of the brain that manage language, such as the temporal or parietal lobes. In some cases, the patient may slur their speech, give unrelated answers to questions, or may not be able to understand what others are saying at all. This is a clear indication that blood flow to the brain has been disrupted. If you notice these signs in a loved one, especially if they appear suddenly and without a clear reason, it is important to seek medical help immediately. If a stroke is not treated in time, it can result in permanent language loss and significantly affect the patient's quality of life. 5. Balance disorders and stroke. Important warning signs. Balance disorders are one of the early signs that may appear before a stroke occurs. The patient may experience difficulty moving, walking, or maintaining balance, and might even fall or feel as if they're intoxicated without any clear cause. This happens when blood vessels in the brain become blocked, interrupting the supply of oxygen and nutrients to the brain cells, especially in areas responsible for controlling balance. Specifically, the part of the brain that controls balance is mainly located in the cerebellum and other regions of the central nervous system. When blood vessels supplying these areas become blocked, the body's ability to coordinate and maintain balance is impaired. These balance issues may appear suddenly, causing the patient to feel unsteady, dizzy, or lose balance while walking. If you or a loved one experiences this, especially if it occurs suddenly or lasts for a prolonged period, seek immediate medical attention. Balance disorders can be easily overlooked since many people might assume they're just feeling tired or dizzy for other reasons. However, if this condition persists and is accompanied by other symptoms like blurred vision, difficulty speaking, or weakness in the limbs, it may be a warning sign of a stroke or an impending stroke. Therefore, early recognition and monitoring of these symptoms are crucial in stroke prevention. 6. Unusual fatigue, a warning sign of stroke. Unusual fatigue is a symptom that cannot be overlooked when it comes to stroke signs. Many people experience typical fatigue in their daily life. However, when this feeling of fatigue suddenly becomes more severe and has no clear cause, it may be a sign of an impending stroke. Fatigue can have many different causes, but when it is accompanied by symptoms such as weakness in the limbs, dizziness, or shortness of breath, it requires thorough evaluation. Unusual fatigue before a stroke occurs could be a sign of insufficient oxygen and nutrients reaching parts of the brain. When blood is unable to flow to a region of the brain due to a blocked blood vessel, the body will feel tired and lethargic. This fatigue does not improve with regular rest and may last for hours or even days before the stroke occurs. If you feel persistent, unexplained fatigue, this is a warning that should be taken seriously. Frequent feelings of fatigue can signal a decline in brain function and may lead to more severe issues. Regular health checkups, especially monitoring blood pressure and cardiovascular tests, can help detect hidden signs of a stroke. 7. Changes in coordination, a key sign of stroke. Another symptom of stroke that many people may not notice is changes in coordination. Patients may experience difficulty performing simple daily tasks, such as typing, holding objects, or even washing dishes. This occurs when signals from the brain to the muscles are interrupted due to a blockage or rupture of blood vessels, reducing the ability to coordinate and control body movements. When a stroke occurs, it can damage brain areas responsible for controlling motor activities. As a result, patients may find it challenging to perform everyday actions that they used to do normally. For example, they may struggle to lift their arms or maintain balance while walking. This not only makes daily activities difficult, but also reduces the quality of life for the patient. Changes in coordination can also be a sign of a transient ischemic attack, TIA. A TIA happens when blood flow to the brain is temporarily disrupted. While the symptoms of a TIA usually resolve after a short period, it is a serious warning sign that a full stroke could occur in the near future. Therefore, if you or a loved one experiences difficulty with simple movements, it is important to seek immediate medical attention to check health conditions. 8. Vision changes, a concerning sign of stroke. Vision changes are one of the crucial symptoms not to be ignored when it comes to strokes. A person may experience sudden blurred vision or double vision without a clear cause. This occurs when blood vessels in the brain become blocked or ruptured, leading to insufficient blood and oxygen reaching the areas of the brain responsible for vision control. As a result, the patient's vision is affected, leading to symptoms like blurred or double vision. Vision changes can occur before the actual stroke and serve as one of the important warning signs. If you experience sudden blurred or double vision, you should seek immediate medical evaluation to identify the cause and receive timely treatment. Ignoring these changes can lead to permanent damage and severely impact your vision and quality of life. Conclusion: stroke is a serious condition that can cause lasting consequences if not detected and managed promptly. However, before a stroke actually occurs, the body often gives frequent warning signs, allowing us to identify and intervene early. The 8 warning signs of a stroke a month before it happens: high blood pressure, unusual headaches, numbness or weakness on one side of the body, difficulty speaking or understanding speech, balance disturbances, unusual fatigue, changes in coordination, and vision changes are all symptoms that should not be ignored. They may appear suddenly or gradually progress, and if not addressed, they can lead to serious complications. Early detection of these signs provides patients with the opportunity for early intervention and treatment, reducing the risk of a stroke and ensuring long-term health protection. If you or a loved one experience any of the symptoms above, it is crucial to consult a doctor to get an accurate diagnosis and appropriate treatment. Always listen to your body and do not overlook unusual symptoms. Preventing and detecting strokes early is the key to maintaining good health and a high quality of life. 9 effective tips to prevent stroke. Stroke is one of the most severe health conditions, and if not detected and treated in time, it can lead to permanent consequences. It occurs when the blood vessels in the brain become blocked or burst, leading to a lack of blood and oxygen for the brain cells, causing brain tissue damage, and severely affecting motor skills, speech, and memory. Although strokes can occur suddenly, there are many effective preventive measures that can help reduce the risk of this condition. Here are 9 effective tips to prevent stroke that you can implement today to protect your health and reduce the risk of a stroke in the future. 1. Reduce salt and sodium intake. One of the leading causes of stroke is high blood pressure, and one of the main factors contributing to high blood pressure is a diet high in salt and sodium. When you consume too much salt, your body retains water, increasing blood volume and raising blood pressure. High blood pressure damages blood vessels, making them more prone to blockage or rupture, thus increasing the risk of a stroke. Experts recommend consuming no more than 5 g of salt, about 1 teaspoon, per day. However, most people exceed this amount, especially through processed foods, fast foods, or takeout. To reduce your salt intake, limit foods that are high in sodium, such as processed foods, fast food, and canned items. Instead, opt for natural seasonings like herbs, garlic, and lemon to replace salt in your meals. 2. Control blood sugar levels. High blood sugar, especially in people with diabetes, can damage blood vessels. Prolonged high blood sugar can thin the walls of blood vessels, allowing bad cholesterol, LDL, to build up on the vessel walls, forming plaques. These plaques can block arteries and reduce blood flow to the brain, increasing the risk of stroke. Controlling blood sugar is an important factor in stroke prevention. You should regularly check your blood sugar levels and maintain a balanced diet to keep your blood sugar within a safe range. This includes eating fewer refined sugars, increasing your intake of vegetables, fruits, and whole grains, and maintaining an active lifestyle to improve the body's ability to utilize sugar. 3. Don't smoke. Smoking is one of the top risk factors for stroke. Nicotine and other harmful chemicals in cigarettes can damage blood vessels, raise blood pressure, and accelerate the process of atherosclerosis, plaque formation in arteries. Smoking also reduces the ability of blood to supply oxygen to brain cells, making them more vulnerable to damage. Studies show that smokers are twice as likely to suffer from a stroke compared to non-smokers. If you are a smoker, quitting is an essential step to reduce your risk of stroke and improve your overall health. If you don't smoke, avoid exposure to secondhand smoke to protect your health. 4. Manage cholesterol levels. Cholesterol is a type of fat necessary for the body, but when levels of bad cholesterol, LDL, are too high, it can harm arteries, causing plaque buildup and restricting blood flow. This decreases the blood supply to important body parts, including the brain, and increases the risk of stroke. On the other hand, good cholesterol, HDL, helps clean up plaque in the blood vessels, and protects the cardiovascular system. To maintain healthy cholesterol levels, follow a balanced diet that avoids excess saturated fats and trans fats. Instead, focus on consuming foods that contain unsaturated fats, such as olive oil, avocados, nuts, and fatty fish. Additionally, regular exercise helps increase HDL, good cholesterol, and reduce LDL, bad cholesterol. 5. Regular exercise. One of the most effective ways to prevent a stroke is to maintain a regular exercise routine. Studies have shown that people who exercise regularly have a lower risk of stroke compared to those who are sedentary. Exercise helps improve blood circulation, reduce blood pressure, control weight, and relieve stress, all of which contribute to stroke prevention. Experts recommend that each person engage in at least 150 minutes of moderate-intensity exercise each week, which is equivalent to about 30 minutes a day, 5 days a week. Activities like brisk walking, running, swimming, cycling, or yoga are beneficial for cardiovascular health and help reduce the risk of stroke. 6. Control weight. Being overweight or obese is a major risk factor for stroke. Excess body fat, particularly abdominal fat, increases inflammation in the body, damages blood vessels, and raises blood pressure. Additionally, being overweight increases the risk of other conditions like diabetes, high blood pressure, and high cholesterol, all of which contribute to stroke risk. Maintaining a healthy weight is essential to reducing stroke risk. You can achieve this by making healthy dietary changes combined with regular exercise. Ideally, aim for a body mass index BMI between 18.5 and 24.9. 7. Get enough sleep and monitor sleep apnea. Quality sleep is crucial for overall health, particularly heart health. Sleep disorders, such as sleep apnea, can increase the risk of stroke. When you experience sleep apnea, your blood oxygen levels drop, causing oxygen deprivation for your body, especially the brain. Sleep apnea is often undiagnosed until symptoms become more evident, so early diagnosis and treatment are important. If you feel excessively tired during the day despite getting adequate sleep, or if someone has noticed you stopping breathing during sleep, consult a doctor for evaluation and treatment. 8. Manage blood pressure. High blood pressure is one of the leading risk factors for stroke. Prolonged high blood pressure can damage blood vessels, leading to blockages or ruptures, which cause strokes. To prevent stroke, you need to monitor your blood pressure regularly and take medication if needed. Ideal blood pressure is around 120 over 80 mmHg. If your blood pressure exceeds 140 over 90 mmHg, consult your doctor for appropriate treatment. It's important not to stop your blood pressure medication without the guidance of a healthcare provider. 9. Check your heart rate. Heart rhythm problems, particularly atrial fibrillation, AFib, can increase the risk of stroke. AFib prevents the heart from pumping blood effectively, causing blood clots that may travel to the brain and result in a stroke. If you feel your heart racing or beating irregularly, seek an immediate heart rate check. Regular heart rate monitoring, especially for those with a history of heart disease, can help detect early issues and allow for timely treatment to reduce stroke risk. Conclusion: stroke is a serious condition that can have lasting impacts on the quality of life. However, healthy habits in daily life can significantly reduce the risk of this disease. Preventive measures like reducing salt intake, controlling blood sugar, quitting smoking, managing cholesterol, regular exercise, and controlling blood pressure are all vital to maintaining cardiovascular health and lowering the likelihood of a stroke. Always be proactive in checking your health and take preventive actions now to protect yourself and your loved ones from the dangers of stroke.